Patients ask me about the Solea laser, and it's interesting because the term laser dentistry is used quite often. There's so many different lasers, so many different levels of what they can do, that the term laser dentistry is just way too generic. I've been using the Solea laser for 11 years now as one of the earliest users of this device. Before that, I had another laser, was also what's known as an all-tissue laser, which the Solea is. An all-tissue laser means it can be used on your teeth for cavities, it can be used on your gums, it can be used for bone, etc. Previous laser I had was considered the best at the time. There's a lot of people who still use it, but Solea just brings everything to the next level. With my previous laser, I've been promised that I could do things like most of my fillings without anesthesia and do all kinds of gum surgeries. And you could do some of those fillings without anesthesia, and you could do the gum surgeries, but they would be not very clean and neat. There would be a lot of bleeding and more patient discomfort afterwards than with my Solea. The Solea is the most unique laser. I'm able to do, almost any procedure that I can think of with the laser instead of with the scalpel and a drill. If you can take the shot, the numbness, the injection out of the equation, take a scalpel and bleeding out of the equation, and take the drill out, those are all things that make the patient experience better, but also allow me to do minimally invasive dentistry because the Solea is so precise. I can do at least 90% of the fillings I do without an injection, and I can do all kinds of gum procedures, many of those without getting a shot, with things looking very aesthetically pleasing afterwards, because it's not like you have gums that look red and bloody. Things look very clean and neat. There's very little post-operative discomfort. So when I call patients the night after doing a surgery, they're usually shocked at how good they feel. So patients who haven't had a filling in a long time, for example, whether it's an existing patient of mine or a new patient, it's funny because they'll come in and I'll use the Solea and they'll say, "Oh, so this is what dentistry is like now." And I'll kind of laugh and I'll say, "Well, it's what it's like in my office, but it's still relatively rare. And hopefully one day, every dentist will be using the Solea, because it really is just, the most amazing technology, and I could not take care of my patients without it."